All right, welcome everyone to the ArMA virtual town hall. We'd like to thank everyone for taking time out of your evening to join us. Just a quick housekeeping slide here for everyone. This is a professional environment and we ask that everyone remain respectful towards all participants. This webinar is being recorded, will be published at a later date on ArMA's YouTube channel for you to go back and review. You can see and hear us, but we cannot see or hear you. The webinar is best accessed through your computer utilizing the functions such as the Q&A. So if you have any questions, please feel free to submit your questions through the Q&A function or any comments through the chat. And then the best viewing option is for you to fit to the window. The moderators tonight is going to be Megan McCabe, ArMA's Deputy Director of Government Relations, as well as myself, Damian Johnson, ArMA's Director of Communications. Tonight's guest panelists include Dr. Leanne Kelly, President of the Maricopa County Medical Society, Dr. Robert Siegel, President of the Pima County Medical Society, and Dr. Ross Goldberg, President of the Arizona Medical Association. At this time, I'm going to turn it over to Dr. Goldberg to give a quick update from ArMA, and then we'll move on to our guest panelists. Dr. Goldberg.
Thanks, Damian. Welcome, everyone. Thank you all for attending. We appreciate it. We know things are always a bit interesting every week, and we have to address. We are here to answer those questions and have those discussions. I want to thank my fellow co-leaders for being on as well. I'm going to kick it over to them. We recently have had communications on what we've been doing, and obviously you're here to ask us questions, so I'm not going to take up time just randomly talking, and I'll kick it over to Dr. Kelly or Dr. Siegel, whichever one you'd like to speak first. By all means, the floor is yours.
Do you want me to take it away?
Kelly, sure.
Okay, Dr. Kelly's still muted. Hi, I'm Bob Siegel. I'm a dermatologist. I teach dermatology and medicine at the University of Arizona in Tucson. I am president of the Pima County Medical Society. We have 1,400 members, astonishingly, for our little society. We're all very concerned about COVID. Everybody's life is completely upside down here with COVID. I myself have been affected because I shut my practice down at the university March 13th when there were 9 cases in the county, and now there's 1,000 times as many cases in our little county. I'm practicing dermatology strictly by telemedicine, and it's a challenge. It's tough. Everybody has their own personal story. Occasionally when we have our board meetings, people will say what they're doing, and we get some surprises. The emergency room doctors are pretty much overwhelmed these days, and the psychiatrists are really enjoying their time at home. Most of the regular doctors that are in the trenches are having a difficult time with furloughs and reimbursements, and telemedicine it's a stretch to get it up and going. As far as the society goes, our little Pima County Medical Society has been fairly active. We have 3 staff members, 1 full-time and 2 part. We don't have the resources that ArMA and Maricopa County Medical Society have, but so we can't access our state politicians every day all the time, but we do have some access through Dr. Teresa Cullen, who is our brand new Pima County Health Department Director, and she's on our board of directors and gave a illuminating hour-long question and answer talk the other day. She told us that her major challenges were they're nowhere even close to being able to do contact tracing, and that all across the board, there's challenges getting testing done. And we know that from our colleagues who are running out of reagent or swabs or one thing or the other. At the beginning, the Pima County Medical Society executive director had to contact doctors' offices to find, on behalf of patients, to see where they could go for care. That's all been straightened out. Early, we did support the Arizona Society of Anesthesiologists in its effort to limit the expansion of the scope of practice for nurse practitioners to be done during the healthcare emergency. That argument was well discussed, and there were strong arguments on both sides of that issue. we have increased the frequency of publication and the length of publication of our little newsletter, and we're on Facebook. I think it's really a superior little publication for such a small society. We give quite a bit of information to providers about the latest status, and it was through this Facebook that we sent out information on the really highly regarded PPE items that were provided by your guys in Phoenix. And in addition, some of our members went up there to pick up the supplies and brought it down here before things are being delivered, so that it made it easier for doctors to get it. And I really do appreciate the effort that you made to get those PPE and have them juried, and they seem to be pretty good. Through the University of Arizona recently, we just offered a senior elective in organized medicine and advocacy. And this is a class that takes a month. Our most recent graduate from this class is on the ArMA student diversity section. And in addition, she looks like she's headed towards a career that will embrace organized medicine. We have changed, we do have a walk with a doc. I don't know if you guys have a walk with a doc, but every week or two down at the Riverwalk, the society puts up a table, offers water, sunscreen, information, maps, and anybody that wants to show up and go for a walk with one of the doctors that volunteers their time and energy is a great thing. But recently we've stopped that, but we're having virtual walks with a doc with some of the residents who are members of our society. As you probably all do, membership is tough. We had an interesting, the society sponsored a really great meeting the other day with the University of Arizona and a couple of the hospitals in town. And at it, a podiatrist attended and she said, "How come I can't be a member of the society?" Well, we checked our bylaws and it turns out she actually can be a member. We just have never welcomed podiatrists, doctors of podiatric medicine, DPMs. I don't know if you know that what DPMs do these days, particularly in the academic and hospital setting. They do everything. They prescribe all the drugs. They take care of really sick patients. They're valued members of the wound care team. They do flaps and grafts and vascular surgery, and they're here at the Southern Arizona Limb Salvage Association, and they work with a plastic surgeon. And so anyway, so we made the effort to involve podiatrists in our county society. And so we did not have to change the bylaws, but they are now anyone that wants to, and we do have 3 full members of the society. I bring this up because I'm not 100% sure that a doctor of podiatric medicine can be a member of ArMA, but if not, I think that we would like you to investigate avenues where they could be. So that's the situation from the County Medical Society. As you all know, Arizona is doing terribly in managing the COVID pandemic. We are 14th in population in the United States. Our state is the 14th largest state as population, which means we have 2% of the population, but we have 3.5% of the total US cases. In other words, Los Angeles County is the biggest county, Cook is second, Maricopa is 4th, but you're 3rd in the number of COVID cases. By total cases, in other words, Arizona is number 8, whereas by population, we should be 14. And the way it looks, we're gonna make number 7 tomorrow or the next day. Another way to look at it is COVID cases per million population, and we were 7th. And as I say, we should be 14th, but we'll be 6th in a day or 2. So we're doing terribly. The COVID situation is miserable. I do work at University of Arizona and also Banner. I spoke today to a couple of the doctors from Banner. They've advised me that, that Banner is utilizing resources not originally designated for COVID intensive care patients and staff that's not originally utilized. In addition, patients are being shifted around from here to there using the statewide system, but we do not have any shortages of personal protective equipment. Patients are being well taken care of. And we do know this because there is, if you look at the statistic on deaths in Arizona, versus cases in Arizona, we're doing actually very well in that regard. So we think that Arizona is delivering good care. We did make the news today in Vox why Arizona is suffering the worst COVID-19 outbreak in the US. It's a really good article. It's free, you can get it. And it discusses how we opened up too early and we jumped from 0 to 100 miles an hour with the COVID numbers due to probably some administrative decision-making that was flawed. So that's the view from here. I'm gonna stop now, turn it over. I'll be here for questions in a bit.
Okay, I guess I'll go next. So I'm Leanne Kelly and President of Maricopa County Medical Society. I'm just going to go over some of the ways that our society has responded to COVID in the past few months. We have served as the distribution hub for the bulk PPE purchases for physicians throughout the state. This was done in conjunction with the other organizations here and some out-of-state organizations. Through our 501c3 nonprofit arm, the Academy of Medical Science of Maricopa County, we solicited donations to purchase PPE for the doctors in need, as well as making it a possibility for doctors to order PPE from this program. We also handed out free masks and other PPE on a first come, first served basis, and we'll do that again for members. And we've also gotten a lot of donations of cloth masks that we've handed out to people that needed them or wanted them when they came to pick up their PPE, for instance. We have a quarterly magazine, Arizona Physician, that's mailed to, I think, 12,000 doctors here. And the summer issue is going to have a theme of COVID-19 impacts on medicine. We've launched a new podcast service, the Arizona Physician Podcast, and we have 2 episodes each month. Some episodes will focus on doctors' perspectives and experiences during the pandemic response and how it may have changed their practices or their care for patients. So if you can please listen and subscribe to this through Apple Podcasts or Stitcher, Google Podcasts, TuneIn, Spotify. You can get more information on this at arizonaphysician.com. We wrote a couple of powerful letters to Governor Ducey urging swifter action to prevent more cases. And for those, we have received extensive coverage in television, print, social media, radio media, and did a television news interview at the MCMS building. We have solicited volunteers for a county level response, and following Arizona Department of Health Services guidelines or guidance, we referred those volunteers to sign up through the emergency system for advanced registration of volunteer health professionals, which is a pre-existing county, or it's probably bigger than the county, a system for people to volunteer their time if they're a health professional. We've participated in weekly calls with the county health department, and then we push out the relative information to our members. We've had a series of online discussions for physicians, kind of a support group for people to share their experiences during this pandemic and get some tips for stress prevention. We've shared information on the Hospitality for Hope initiative, which is a way for physicians to prevent transmission to their family by securing an inexpensive or a free room at area hotels. We've hosted a virtual CME event called The Legal Implications of COVID-19 for Medicine with the guest speaker, Bob Milligan, a Phoenix-based law firm, Milligan Law. We're working closely with some partners to secure pharmaceuticals for opiate dependent patients during the pandemic. And we'll share more information about that program in the coming weeks. We wanted to hear from medical students in the Valley how the pandemic has changed their experience with medical school. So we hosted an essay contest. The scores just got compiled today, so we'll be announcing the winner very soon. and that winning medical student will receive $1,000 prize money for their winning essay. And we know that the fall will be an especially difficult period for the community as flu season comes along and mixes with the COVID-19 incidents. So we are hosting back to school wellness checks to provide flu vaccinations, sports physicals, etc. So I hope people will contact us about participating in those back to school exams. So if any of this interests you, just please email mcms@mcmsonline.com and we will respond to that inquiry. I think that's about all I have.
Thank you, Dr. Kelly. We're going to go ahead and just jump into some questions here from the audience. Start with the first one here. How do medical doctors get tested for COVID? Dr. Siegel, would you like to go first?
That's outside my area of knowledge, and I am not aware that a medical doctor in practice can get a special place to get testing. I do know that at the university in Banner, we did have a push to test anyone that wanted it, and that happened fast. And we do have a strategy if somebody has symptoms or is test positive before they come back to work. But the testing for doctors who work at University in Banner is through Banner's employee health area. And I don't think there's any shortage of tests for doctors that want to get tested.
I think it's right now hospital based. I mean, that's the issue. We don't have a global one, which is something we could ask and see if they're going to do. One thing that's also coming online is the ASU saliva testing, but it's only being done at ASU, not surprisingly, but it is being validated now, so that will increase testing. But as far as a specific one for physicians, there isn't, but it's worth bringing up, and potentially even not just for physicians, but prioritizing if a physician needs to get tested. So we can ask. Testing is a sore subject throughout the state, no matter who you talk to, because we all agree that it needs to be better. I don't think anyone disagrees with that, except maybe, the federal leadership that aren't here. But everyone within the state agrees that we need to do better with testing. And it's fair to say if the healthcare workers need it, because we need to take care of people, then we should get a priority. So we have no problem asking that. I don't know of any. I don't know, Leanne, if you know of any where it's a grouping specifically for doctors. I'm not aware of any.
I'm not aware of any either. And on the Facebook groups that I'm in that are solely for physicians, people are always asking this, and it seems to be a moving target. Like one person will say, oh, this location's testing, and then somebody else will say, well, I went there and they had run out, so it just seems to be like constant, oh, at this place we had a 6-hour wait, and I got right in, so that it's not consistent. The people who are out in private practice or are not employed by a hospital, I think probably are at a real disadvantage for this access to the testing, because they're just in line with everybody else. Unless they have a friend who's a physician who's doing the testing, or their own clinic is doing it, then they probably do have a little bit of head start there. But in general, it's a service that should exist, and it's a really good point. So we're definitely going to, after this meeting, look into it for you guys.
One of the most horrifying statistics to come out of Arizona is the fact that 26-point-something% tests of COVID being done are positive. That suggests that there's a lot more COVID out there than we recognize, because we're only counting actual cases. And this is a question that came up a minute later. And so it's estimated that maybe there's 4 times as many cases as we're discovering, and it may be as many as 10, but it's probably closer to 4, according to what I've read. And so when the number that this should be is less than 5% being positive. So patients with symptoms or concerns or exposure, if we're at 5%, I think we're doing well. And at 26%, it's petrifying, because our curve is going to go ballistic.
And also, just going off the case thing, in the hospital even, we're seeing people who come in that were originally negative are converting while they're in the hospital. I had actually a case cancel recently for an inpatient consult. The patient was negative when they came in. I tested the day before or the day of actually surgery, and they came back positive. And so people asking, are we double counting then? No, each person gets an individual identification. And once you're deemed positive, you're positive. And no matter how many times you test positive again or don't test positive, you're done. Once you become a positive, that's where you are. But we're seeing these delayed results too. So we're having issues all over the place, and we're able to test in my facility with relatively good turnover time. We're doing it internally. So, but not everyone can do that. And we're running out of tests too. We're going to run out of resources, I'm sure, in the near future. That's the problem. It was reagents in the beginning, then it became swabs, then it became testing sites, then we're back to reagents again. So it's kind of playing whack-a-mole at the moment with this.
Yeah, from what I've heard, there is money available to beef up our testing program. And, you know, there's a lot of talk about contact tracing, but in fact, it's not possible for this illness, unless we can get a much more rapid resulting test. Because once we get to the point where somebody gets a test and then waits for the results, you know, they've infected quite a few other people, and the people that they've infected have already infected other people. So it's not working with our current system, but as soon as we can get some rapid results, then, you know, contact tracing may be viable.
I will say also, just for more testing information, so Deborah Burks was here last week. Libby McDaniel, our CEO, was at that roundtable with her and the governor and Kara Christ. And one thing that came up regarding testing, I think it was Sonora Quest, I don't remember which one. They talked about there's this thing called Operation Catapult. I'm not lying, that's what it's called. It's partnering with some German company where they're going to ramp up their testing by threefold. So it's not here yet, but there is some efforts being done because the Sonora Quest and LabCorp have admitted they're a little overwhelmed, and that's why you're seeing the testing delays. DHS is monitoring, like every time we meet with them, they give us an update. They have a daily update of the turnover time, and ideally it wants to be under 3 days, but obviously we all know that's not where they are right now. So we need to help push that. There have been supplies coming from the federal government that we understand, but obviously not enough. So there are efforts being done, and you can argue about the timing of the efforts versus where we were before. But since we are now one of the more hard-hit areas, we are getting more focus and more resources allocated to us, which is good now. It's just too bad it has to be in this state for us to get them.
One of the attendees just mentioned that it took 7 days to get their COVID results, and Sonora Quest didn't prioritize for healthcare workers.
And we can talk to them. I mean, again, we can talk to the state too. We don't promise anything here magical, but we don't ask, we don't know. And so I think it's reasonable to say, look, you know, we're on the front lines doing all this, you know, maybe, you know, think about it. We could try. They're really good at saying no, but we're really good at asking no. So, you know, you never know.
Thanks everyone for that robust discussion about testing. Our next question comes in with regard to PPE. There are national news stories reporting that saying governors from surging states like ours are not reporting any issues with PPE. However, there are reports that nursing staff are being asked to reuse PPE, suggesting that there perhaps is an issue. Is there any insight from the panelists in terms of PPE availability and whether Governor Ducey at some point will ask the federal government for help on PPE?
We meet with DHS, like I said, every week, and PPE always comes up. You know, they're monitoring. Again, I'm sure everyone has different stories about wherever they are. And I want to shout out again to Maricopa County, our partnership about being able for especially the private practice docs to buy PPE kind of directly. You know, I could say at my hospital, they publish every day what we have available, what we don't, and we work on getting things. Every system I know is working on that. I haven't heard of a statewide shortage, but one could argue is that we are always in the need of PPEs. We're going through them a lot faster now with all our new protocols. I don't know if you guys have heard that there's a statewide shortage. I do know that it's always being looked at. I know at Maricopa County, if you need stuff, you can still fill out the forms and request, and they have some supplies left. I don't know how much they have left, but they do have supplies left, and you can go through your county health departments to get that information. The state was very big on pushing everything through the counties, and they really want you to go through your county department. So the default for a lot of this is reach out to so either Pima really or Maricopa here, or whichever county you're in, obviously reach out to your director there. They're the ones who are supposed to help facilitate getting these things.
Let me mention that the CDC just came out, I think today or yesterday, recommending the addition of face masks to standard PPE in the ambulatory setting. The reference is at cdc.gov/coronavirus 2019. And so Banner has now required providers in the clinic to wear face masks. If you are behind a sneeze guard, you don't have to, to wear a face shield as well as a face mask. Did I say mask? But I meant shield. And so the face shield, you know, the clear shields, these seem to be very protective. And there's been some discussion as to whether the shield is equal to a mask, but most people think that it's not as good as a mask, but it's still very, very good. And when you combine them, you've got better protection for the individual wearing them. I should say that the University of Arizona, of the 4 levels of protection for individuals, views personal protective equipment as being the tip of the pyramid. That is to say, the least important factor it's your final defense against the COVID. It's way better to not have any exposure to it by being outside or in a workplace by altering the hours so there's very few people present. And if you're normally there for 8 hours, making it 16 or 24 is better, so there's fewer people in a facility at a time. And then the 3rd level is having airflow improved so that the airflow is dramatically improved because this is an aerosolized virus. And then the 4th level is PPE. That's all available through the University of Arizona College of Public Health, and they've got really good information on that free website.
And I would say also our hospital recently changed over the requirements. So for everyone we interact with, every clinical area, you must have either a face shield or goggles, a mask, gown, gloves for every patient encounter. So we're doing that too. Like we're all running around getting face shields now. So I think that's becoming more of a norm.
Yeah, that's good.
That's the requirement at Mayo Hospital also. You have to have face shield or goggles and wear the mask under the face shield or with the goggles for, you know, extra protection. But apparently the eyes are becoming more of a focus in terms of, you know, mode of transmission being exposed.
It's a tough one. One of our staff administrative people got sick with COVID, and she's at home with nobody else there. She only goes to Safeway and Costco, so she either caught it going or coming at one of the stores. And she wore masks everywhere and used wipies and did everything you're supposed to, and she still got it. So it's really contagious and it's very troublesome. That's a case report of 1, but goodness gracious.
But the problem is not everybody at the grocery store was wearing, I mean, everybody at Costco was, but not everybody at her grocery store was wearing a mask. I can guarantee you that. So, you know, my hope would be that perhaps we could put some pressure on the merchants to start enforcing their mask policy and, you know, potentially have some consequences for the merchants if they don't comply with that. Because you can wear a mask, but if the person who, you know, maybe carrying COVID isn't wearing one, then you're really not very protected. And unfortunately, you know, wearing masks has become a very politicized issue, and locally it's a big problem. So, I also meant to mention that the VA hospital is also requiring face shields or goggles and are supplying those to the doctors there now.
I would say for the goggles too, it's funny because it's amazing what you learn during something like this. So it depends on the type of goggles too. You can't just get any type of goggles because the goggles need to cover everything, right? The whole point is to shield. But if they have holes in them, they're no good. Like air vents are no good. They have to have one-way air valves. Like this is how detailed we're getting about these things, that you have to get specific goggles to do specific things. Because when they told me to get a pair of goggles, I'm like, okay, no problem. And they're like, no, you need this, you need this, you need this. So I'm showing pictures to my CMO and CNO saying, are these appropriate or not before I get them. So we really have to be kind of careful with it because it is specific things you need. The whole idea is to prevent that airflow in and let kind of things come out. So it is getting very nuanced with it. because it is so contagious. I mean, we're seeing the numbers go up every day.
The people that wear glasses, I've been told by a doctor recently at Mayo that they make prescription goggles, and the cost for them isn't nearly as high as you think it might be. So that might be an option for some people over, the face shield.
Yeah. Basically now it's from here to here and here to here definitely has to be completely covered. And Saran wrap's not really going to do it. So you got to do something else.
Thank you, everyone. I got a couple questions I'm going to run through. This one I think is going to be quick here for Dr. Siegel. It's a question from Ken. Can the U reopen the hospital rooms in now Tower 4 for patient care, or have they all been remodeled?
I asked that very question, worded a little bit differently, of Rebecca Ruiz McGill, who is at Banner, and she is a public relations person. And she said at this time, there's plenty of capacity for both COVID and non-COVID patients. They're balancing the load between Banner hospitals, but no one so far has been sent out of Tucson to Phoenix. They're utilizing as much critical care space as possible in all areas of the hospital. And when Banner did build the brand new tower, they left several intensive care units alone in both Diamond Children's and the old part of the hospital. And those, I think, are coming online. Also, they are exploring options to convert single occupancy room to double. Plus the staffing, we have upskilled workers. That's a new word for me. They've upskilled 700 workers and taught them new skills to help take care of these deathly sick patients. And also this, in the past 2 weeks, Banner has brought in nearly 400 contracted workers from out of state. So regarding ICU bed availability, we seem to be okay right this minute, but it's a thin line. I don't want to sensationalize it, but we're doing okay, but I really, really wish we'd get better leadership from the top. The state really should be, from my perspective, should be shut down. And if I ruled the world, I would institute a statewide requirement for masks, close pretty much everything that we can, and go the way, and maybe even do something like some of the Middle Eastern countries have done, where you prohibit people from going more than 200 yards from their house unless they have an essential function.
Thank you, Dr. Siegel. Another question here tonight. ASU Biodesign Institute says they're working with ADHS on the rollout of their upcoming saliva test for employers. Have any physicians or hospitals been discussing with ASU about using the saliva test for their employees?
I know not for specifically employees, but I know hospitals have been in discussion with them about using the test. I don't know where and how, because again, you can rapidly use it in a lot of places. The turnover time's the same. I want to be clear though, it's not a rapid test. It's just a different way of collecting that's still going through the same turnover time. I verified that yesterday, but I do know that hospitals have been talking with ASU. Right now, the only place that can validate the test is ASU. So that does limit their ability right now, because you have to go to an ASU site to do it at the moment. But the goal is, my understanding, is to really get it widespread. DHS is excited. They keep on calling it a game changer. We'll see. But because again, of how much you can collect and how fast, and obviously we have gotten better from going from the brain biopsy now to the nasal swab, but if we can do saliva, that's great. But I know that they are talking to hospitals. I mean, my hospital may be one of them. That's why I may know. But, I do know they're talking to hospitals.
Great, thanks everyone. We've had a couple questions come in about the use of hydroxychloroquine. I know this has been a hot topic in the past, and specifically about the county medical societies, and if you have any plans to relay information about hydroxychloroquine to your membership.
Well, that's a hot topic. From my perspective, the use of hydroxychloroquine in a viral infection never made any sense. We do, in dermatology, prescribe a lot of hydroxychloroquine for patients with inflammatory disorders such as lupus. And it really hurt some of these patients who really needed and are benefited by it when the drug went missing and was not available in the stores, and the governor even, I think, restricted the numbers of pills that a person could get. So, but I was glad to see that this appeared to be a flash in the pan and didn't stand the test of time. It's not generated sustained enthusiasm. There's many papers that discourage the use of hydroxychloroquine. There's cases where people take it and don't do well. I think, though, there is a small coterie of people who believe this is a valuable drug. In this scenario of COVID infection, I am not one of them. So I don't have any plans to encourage our society to do anything to encourage its use.
Yeah, there really have been a lot of drugs promoted at one time or another along the way here, including estrogen patches, progesterone, and that's for males or females. I don't know if famotidine is still, being promoted. Melatonin, I think, was even on the list at one time as something that might help. So, I think that a lot of what's happened is, they were just kind of trying to correlate, oh, this person was on this, so, and they survived, but that person wasn't on this, so they didn't, and trying to kind of go at it backwards. And part of it was probably just throwing everything against the wall to see what would stick. And so some of it was just based on, insufficient data to really make a scientific conclusion. So, but, some people have gotten stuck on certain things for certain reasons, but I think the most important thing is we just really have to stick with the evidence-based medicine here.
I'll just say from ArMA, actually, you say, it's funny, I just saw a study sent out to me today that actually people on PPIs have a higher risk of developing COVID now. They're finding links there. But again, that study has to be looked at and reviewed. So that's why I would always say that from ArMA's perspective, we're trying to follow all the evidence we can, but not just because a paper says one thing or another, but checking the study itself. Is it reproducible? Again, using good scientific tenets, evaluating evidence-based medicine and seeing if it's reproducible. So whatever that comes out, we will try to promote, but individual one-off studies we're not going to do. If they're not good science, we're not going to do that. So they need to be validated the best they can, because we all know we're 7 months into this. We have no idea about this disease. Do we want to start the conversation if an egg is good for you or not? That's only been like 40 years of discussion. So it's really, we have to make sure we follow the science. And I think it's prudent upon all of us, since the media is now doing this and they're broadcasting all this information, that we need to tell everyone to stop and listen to us, and we need to evaluate the data with an open mind. I'm not saying one way or another towards any drug. Look, I don't care, whatever works is great as long as we can do it safely. But I want to make sure the data backs up what we want to do and that it's reproducible. We don't want to get caught by having these studies get pulled back. We don't want to start giving information about, we're hopeful about things, but don't want to guarantee things. So again, we're going to value and try to evaluate all the data. Keep on sending us things when you find articles. We'll evaluate it with an open mind. And if it shows that it's valid, good science, then yeah, we'll support it.
Thank you all. I'm going to go ahead and jump into the next question here. Are the medical associations considering messaging directed to 20 to 40-year-olds, and especially those in rural Arizona, to encourage them to take precautions, especially given the 4th of July parade and the Prescott Rodeo and Square Dance recently?
If someone could tell me how to do that, I'm all for it. We put out a strong statement before the 4th of July. I can personally say I've been on TV and everything else promoting it. I actually had a patient fire me last week for going on TV advocating for mask use. I have the audio if you want to hear it. It's quite an amazing 2 minutes of my life. And actually, if you want to look, there's an AZ Central article, I think today, where a reporter wrote about wanting to shut down the state and the nasty response they got from a large chunk of the state. This is part of our problem, is they don't care. They want to do what they want to do. I don't know how to get through to them. I'll be honest. We'll keep on talking to them. Unfortunately, the ones that get it understand finally, but the rest of them are like, they don't think it's going to affect them. And they go out and do what they want. So that is a very big problem. And that is what's driving a lot of the surge that we're seeing now.
Let me say something about media. There's an individual now can pick and choose from their media selections and people gravitate towards media that they like to hear. For example, if you tell me that you listen to Fox News, you would never read the New York Times, and that you subscribe to, I'll say, 4 or 5 different magazines, and they're all with the same style, then I think I kind of know who you're going to vote for, and I think I kind of know how you're going to view this COVID situation, because if I listen to some of these same sources, I could buy into it, but I have a much more wide range of interests, and I do listen to some things, but I also do read the New York Times, and so I'm kind of a centrist. But if you say that you have your media choices go more towards this other side, well, I then know how you're going to vote and what your home discussions are like. So what I'm saying is that the media, we're bombarded by media so much. It's so polarizing now, and it's just a microcosm of what we're seeing at the ground level here, with people yelling at each other in Costco for not wearing a mask, and they think that they're 100% totally right based on everything that they see and that they get bombarded with all day, whereas many other people have a different view. So it's a real problem, and it's not the medical society's job really to bring the two sides together, because that's created by the world we live in, where you can pick and choose the media that you listen to. So I don't really know exactly how to solve this, but I just throw that out there as a recent phenomenon.
I will say, having gone on Fox News a couple of weeks ago, we're trying to go everywhere and anywhere to talk to people. So that's what we can keep on trying to do. And I've talked to conservative groups and liberal groups and everyone in between. And, if they want to talk to us, we will. So I encourage all of you just to have frank conversations. I think one thing to do is to not attack. The message I give is that I'm kind of disappointed, and, it's a little frustrating, and, trying to get the civic duty back in people's minds, which of course a lot of people don't have right now. But we keep on messaging. I think we don't come off message. We say, look, this is for everyone's safety. This is to protect your family, your loved ones. If you want to go see your doctor because you have another problem, they may not be there. So, I think we don't want to fear monger, but we just want to be honest and upfront. Again, just ask all your patients, if they get sick, are they going to call their politician, or are they going to call you? So if they're not going to call their politician, then why the hell are they listening to them about what to wear about masks? So I think just keep on the same message. It's just repeating the information over and over again on every platform we have available. Leanne, sorry, I think you were going to say something.
That does bring up the other question of whether people are putting off medically necessary procedures and visits, and if that's going to cause a lasting harm, or if the alternative view is that people are seeing the doctor way too much and it doesn't make a whit of difference in their overall health.
A little of both. I mean, to be honest, we've seen some things that have improved when people not coming and seeing every day. But as a surgeon, delaying cases is not an ideal thing for me, even if it's, elective, because now we have a backlog of like 200 people that need an operation in the same space that we normally use, and their disease could have progressed. So I think you see a balance. We're learning a lot of everything right now, and tackling it is a challenge every which way. But yes, we have learned some visits maybe were not needed. Let's be honest. Some things you didn't need to do, and people are okay. We just got to learn what is necessary and what isn't. That's a natural course of anything.
I just want to add that I think that this whole politicization of mask wearing has resulted in people becoming so fixed and firm in their false beliefs that it's going to be really challenging to convince them or persuade them that this is the right thing to do. I think, making it mandatory, personally, I believe that's the way to go, because many of those people are law-abiding citizens. So if the law requires them to wear a mask, then they reluctantly wear a mask. But they do complain about their freedom being taken away. And, really what I try to tell people is you've had lots of your freedoms restricted. Like, you're free to drive a car, but you're not free to drive it at 90 miles an hour. You're free to smoke, but you're not free to smoke in other people's space, you know, that don't want to be exposed to the smoke. You're free to own a gun, but you're not free to fire it anywhere you want to fire it. You know, those kinds of things. I think if people kind of understand that, okay, this is kind of one of those things, you know, that, you know, if you infringe on other people's rights, then, you know, it's really not your freedom or liberty that's at stake. It's really, you know, the people that could potentially be hurt by you exercising your so-called freedom and liberty to choose not to wear a mask.
I think the basic one, if you want to get to the real basic, can any of you yell fire in a crowded theater? Last time I checked, that was against the law. And isn't that impinging my right to free speech?
Really good points. Thank you, everyone. Next question is from Dr. Andrews. She works at the Phoenix VA, and she said they have open beds at this point, but wants to hear from all of you about how the community is doing with beds and staffing. So perhaps if each of you could speak to where you work, about how you're doing with bed availability and staff.
We could use staff. If you got nurses you want to send our way, we're happy to take them. And I don't mean that tongue in cheek. Well, no, we have beds, but they're getting full, and it's more the staff we worry about than the beds, actually. Also remember, I think all of us have been running at a high rate. Someone had a great example for me today that, like, we've been at like 130% or 130 miles an hour since March. And so at some point you're going to burn through your engine. So I think staffing is a big issue. I appreciate the fact that we're getting staffing in from outside now. I don't know if 500 is enough. That's the total number that was requested from the federal government, but they are sending people in. They are going to be paid for by the states. We thank them for that. People need to fill out a form and request for them at the hospitals, but I worry more about staffing. I know we're at 91% ICU capability, which is scary, but there's the staffing element. If you don't have the staff, then, you know, you have all the beds you want, it doesn't matter. And that's what I'm really worried about, to be honest.
Yeah, I think the staffing is a really big issue because the staff we do have are exhausted now. And, you know, some of the beds that are reported as available, ICU beds, are kind of not really available because they may not have a pulmonologist on staff. Therefore, their occupant of that bed can only be there for 24 hours without a pulmonologist. We're talking about like a rural area. And, you know, I'm not certain of this, but I believe the VA beds are probably only for veterans. So that those beds are counted in the general count. So, you know, some of these numbers can be deceiving. And bottom line is we definitely need more trained staff to help with running the beds, you know, people who know how to do the ventilators and that sort of thing, taking care of the people in those beds. One of my biggest concern is the long-term care center. You know, the people who are aides and are up close and personal with the patients there, and they have a really high rate of infection. And part of the problem is they don't have adequate PPE. They have to wear the same mask, you know, for a long time, like at least all day and probably really longer. They normally, in normal times, would have help from the families, but they aren't, you know, allowed to visit now. So it's all on them, you know, no family members to help. And plus, you know, they aren't probably adequately trained on the proper way to use PPE. So, you know, just some basic things perhaps that they could benefit from additional training, but they could really benefit from using some of the funds that are available, or funds that were given to Arizona to help with some of these issues. And since there is, you know, those young people who work there, you know, taking home to their families and other people, I think that should be an area of focus for us.
And I have no personal knowledge of bed availability at Banner, which is the University of Arizona's hospital that we work with, or the other hospitals in town. But the note I got today was that Banner works closely with the state health department in Pima County and helps provide data that's shared publicly on the COVID-19 dashboard. So I don't know the details about this, but it appears that once information appears on the DHS COVID website, the data website, is probably pretty accurate.
Great, thank you all. There seems to be a few questions regarding testing supplies and the process of testing, such as individuals waiting in their cars for 6 to 8 hours, as well as difficulties with testing supplies and having the adequate supplies needed to continue testing, along with the contact tracing and the utilization of it. I know, Dr. Siegel, you mentioned earlier that there's no contact tracing being done down in Southern Arizona. I know that Dr. Goldberg's had conversations with DHS about contact tracing up here and where we're at with it right now. So I just wanted to kind of open up the floor here a little bit to see if anybody had any comments regarding testing supplies, contact tracing, or anything of that nature.
I'm going to say something a little controversial that may get some people upset, but let's be realistic where we are right now. With the amount of community spread we have right now, contact tracing is not going to help us. We needed it 3 months ago.
Right.
We need community
It's
surveillance.
impossible.
Yeah, I mean, they're doing it. They have National Guard people filling up the numbers, but people aren't giving the information. So contact tracing was great when we didn't have 3,000 cases a day. Because right now it's everywhere. We've proven that. Like, we're running a wonderful experiment of what not to do. So we should have done this a couple months ago. I know there's National Guards going through the list, and they actually went through the entire list of names that they were given, and they called everyone, and they're done. And I don't know what's going to happen next. So as far as contact tracing, will be, I think, better used when we're on a downslope, whenever that is. Testing supplies, I mean, we've talked about already. We all agree we need more. If you can get your hands on some, let us know. There is money coming into it. There's issues trying to be done. It's been acknowledged everywhere. I mean, if I can make it and produce it, I would, but I agree, it's a massive problem. And the numbers we're seeing like today, I don't fully believe, because we don't have enough tests, I think, going out there. I think the beginning people didn't want to get tested. Enough people are scared enough that more people want tests than we have available, and we're seeing the problem occur.
And we just need a rapid test.
Go ahead.
We just need a rapid test to be able to make contact testing or tracing a reality, and to, for it to be at all useful, because as it is, by the time person develops symptoms, they're several days into it. By the time they get tested, there's several days, more into it. By the time they get their test results back, if it takes a week, then there's already been several generations of people that they've, the person they've infected, the person that person's infected, the person that person's infected, so there's a geometric progression that's just, contact tracing at this point, with our ability to get results back from testing. It's personally, I think it's kind of a waste of time and money. We could spend that money elsewhere better.
I totally agree. The ideal thing would be a rapid color match test that's CLIA waived, that's reliable and validated, that you get your results like a strep test or a pregnancy test in a couple of minutes, and it'll be available everywhere. That'd be fantastic. But without that, I don't know where we are. Oh, I wanted to mention, we got an excellent question from Dr. Jane Orient, one of our members down here. Can I go to that one, Megan? Does that be okay?
By all means, please, Dr. Siegel.
When will it be okay not to wear a mask? That's a great question. And who should not wear a mask, and when will it be okay not to wear a mask? I don't know. I think it's until we have a reliable treatment, the numbers are tamped down, that we've got a vaccine maybe, or there's contact tracing, or I don't know. What do you guys think the answer to that is? When will it be okay not to wear a mask? Right now we should wear a mask.
When we get a vaccine is when I will start wearing a mask, if I've gotten it.
I mean, yeah, we need to have some reliable, consistent treatment plan or a vaccine, I think, or at least have people like follow the instructions, at least for like maybe a month. Like, we haven't gotten people to follow all the rules yet. So, look, I'm biased, right? I wear a mask all the time anyway. I've been doing it for a long time, and amazingly, I'm not dead yet. It's an amazing thing compared to what you hear. But I would say that we need to, it's a great question because there is no end date and we all agree that's not sustainable. We need to have some sort of targeted goal, but I think looking for things like reliable, actually vaccines that work, or a good testing, I'm not testing, a treatment regimen, something. We don't have that yet. I know people are going to quote different drugs. We're still all over the place with it. I'm in the hospital. I'm walking in those units. We are trying different things. Some things are working, but something new pops up, right? We weren't talking about dexamethasone a month ago, and now they're saying do remdesivir earlier when you start having oxygenation problems, maybe combined with plasma. It's a changing, system right now. Until we have more reliable ways of addressing it, I don't think we can let up on the preventive measures until we have better treatments.
Thank you all. I got time for one more question here. Then we'll wrap things up. What is the status of elective surgeries in Arizona, hospital-based versus standalone surgery centers?
So I can speak, I guess, on this a little bit. So the governor and Kara Christ went into called a crisis standards of care on June 29th, which gave hospitals the ability to kind of allocate resources it needed. They did not mandate the closure of elective surgery. In fact, I will say I personally reached out to Dr. Chris to have her not do that and to make it hospital-based if possible. My hospital shut down elective surgeries. We're doing only urgent, no non-essential. Now, I'll admit about only 30–40% of what we do was purely elective. The rest is more urgent, cancer cases, things like that, burns. Every hospital is being allowed to do it on their own. I think we need that balance right now, but I will tell you, I know Mayo announced today they activated their surge plan, meaning they're shutting down certain operations. So every hospital is actually being somewhat responsible. I know all the CMOs of the healthcare systems, they meet every week and are trying to coordinate. Surgery centers are still going. Some places are still going, yes. But I think I would rather let them make individual decisions than it come from the governor again, because it just causes a lot of problems with this hard stop one way or another. I don't know if
Thank you, Dr. Goldberg.
have any other thing you want to add to that.
I want to also, before we wrap up here, I just wanted to open it up to see if any of you had any more comments you'd like to make or anything else you'd like to state before we wrap things up. No? Okay, I know that ArMA has put out a survey regarding testing supplies in partnership with the county health departments. Megan's working here to get that added into the chat for those to go ahead and fill out the quick survey. It only takes a couple of minutes to see where you're at as far as testing supplies goes. Be sure to also include your contact information in that survey so we can reach out to you once we do reach back to the county health departments. But I'd like to thank Dr. Siegel and Dr. Kelly, as well as Dr. Goldberg, for joining us this evening. I feel like this was a very informative town hall. I'd like to remind everybody that it is recorded, or was being recorded, and will be published on ArMA's YouTube channel later on this week. If you do have any questions or concerns that you'd like addressed or follow up, please feel free to reach out to us at communications@azmed.org. And then just a reminder as well of the resources that are available to you on ArMA's website, such as telemedicine, COVID-19. There's an FAQ available on there, as well as financial resources regarding COVID-19. So thank you all for joining us this evening, and I hope you have a good rest of your night.
Thanks so much. It was a pleasure.
Thank you.